Hi, this is Dr. Micol Neely, and thanks for listening to our show. We are here to talk a little bit about mindset, movement, and muscle, and maybe a few other little fun things along the way. So many people today are walking around feeling fatigue, anxiety, stress, and they just think that's how it has to be. But let's talk today a little bit about getting into the root cause of things. I'm here with Christina Ivanhoe.
Hi.
How are you today?
I'm good. I'm very good. Thank you.
And you have Golden Heart Wellness Center.
Yes.
So I want to talk to you a little bit. What led you to kind of go towards root cause analysis for people?
I'm going to try not to cry. I already warned you. I think, really it was more of watching people struggle.
Yeah.
And my mom had a mental illness, and then I watched her, and there was, she was never able to get any help. And so this is totally not what I thought I was going to say.
I want to roll with it because this is so important.
Right.
It's how a lot of women are feeling.
Right. But it's so funny because it's not funny, but it makes me sad because people don't, like the doctors are, they've got 15 minutes, right? They don't have time to listen to your whole story. And so I, including myself, I've had 5 colonoscopies. I've been through the gamut of all of this stuff. And so I think that, when you get to the root of why somebody's sick or why they're not feeling well, then you can start to build that house right back up. And so that's really why I wanted to do the root cause, because there's so many roots, right? So, there's emotional, like a lot of people don't know that there's trauma, that the reason, that they may hold on to fat is because they're protecting themselves. Yeah. Their body's protecting themselves. Or, it's that, they've got a parasite or they've got mold or they're short in aminos but really for me, I'm all about like going to the deep level and so that I can get to the root cause of why, because it's mostly lifestyle.
Yeah.
Like it's mostly like, it really is, I think I'm guilty of it. Like I run around with, I had a string cheese and a beef stick as I was on my way over here.
Yeah.
And I had a piece of crackers. So, just because you're just in the, nobody's
we teach everybody else.
Nobody's sitting down to eat.
Forget to take care of ourselves. Yeah.
Right. And it's so much so that I'll go so far to find all the clean, healthy habits, because that is typically most of my clients. They're high execs. They're, they have a certain amount of time in their day, and a lot of it doesn't include taking care of themselves.
Yeah.
And so I like to really, with the epigenetic hair test, it really gets to the root. And so it's been cool to watch people heal through that.
Tell me, you say epigenetic hair testing. So this is big. A lot of people probably don't know what that is. What is epigenetic hair testing?
So basically, I'm testing your hair. So hair goes back 250 days.
Okay.
Versus blood, where it's only 72 hours. Okay. So it tells the whole picture, which is awesome. So I'd pluck your hair, and then we know within 15 minutes of the appointment.
How much hair are you taking
Just
out?
a little bit in your occipital bone.
Okay.
It's right. And if they're bald, because I always get that, they're like, what if I don't have any hair? It's the eyebrows.
Eyebrows, okay.
But it really tells so much. Like it tells us if there's a parasite, if there's mold, if there's hydrocarbons, if there's metals, if what food you're allergic to. It tells you the aminos, the vitamins, the minerals, all of it. And it goes to, and the EMFs. A lot of people don't even know that they're not sleeping because, that they're plugging their phone in by their bed.
Really? You can see that from
Oh, yeah. Yeah, it tells it all.
testing.
Yeah, and it'll tell you microwave, it'll show. And I'm like, do you microwave your food? And they're like, yes.
Interesting.
Yeah.
Interesting.
So it's really, it really goes that deeper layer. That's what forensics use. They use hair, right?
Okay.
Because hair doesn't lie.
I've heard it for drug testing.
Yes. Well, but so that's really the typical, it just shows the broader spectrum versus only 72 hours when you have your blood test.
Interesting. How often are you doing this testing?
So every 90 days.
Okay.
And it's really cool because I just had one of my clients, she's been with me for 2 years, and she's tested every 90 days. And not everybody has to test every 90 days, but she's a ballroom dancer.
Okay.
And so she literally, it was like us peeling the layer off. And this was the first time last week she was clean.
Really?
And it was so cool because you could tell she's a totally different person from 2 years ago.
how does that program look then? So we get this epigenetic hair follicle test. You look through it.
Yeah.
And then you'd sit down and talk with me.
Yeah. So I would basically, I would get the hair test and then so first of all, you'd fill out a questionnaire and then that tells me everything, like what you're taking. So I do a lot of research prior because a lot of people, they could be on like hydrochlorothiazide, like, these blood thinner or any of the stuff that like, that. And then so I check to make sure that nothing's going to interact. And then I also show them what the symptoms are. Like, because some of the time they're taking something they don't need to be taking it.
Yeah.
I had a guy that was taking an estrogen blocker and he was feeling like, it was horrible. He thought literally for sure he had a parasite and he did not. He had no estrogen.
His estrogen is and men because he was taking estrogen.
Yes. I'm like, you're not going to grow boobs. I promise. Like you just need to they automatically think because they take the testosterone that they need that they need the estrogen blocker.
Yeah.
And they don't because they're just a little bit like us. They have this, he was having the same symptoms of how his body ached and all the things. He felt horrible and he couldn't believe that he didn't have parasite. I'm like, dude, you're taking this. So this is what is happening.
Yeah.
And just that little tweak.
The problem with do it yourself,
Correct. Right.
Which a lot of people
we're all guilty of.
Yeah, me too.
Oh, that's great. Let's do it. Yeah.
But it gets discouraging when you go to a traditional medicine and they say, yeah, your labs are normal.
It looks all good. The time.
Like nothing's wrong with you. Just deal with it. Right?
And that's what I get a lot of. Like I had, it's so frustrating. It even happened to me. Like she's like, oh, my testosterone was at like 228 and my estrogen was like at 118. And she's like, these are all normal. I'm like, they are not normal. I'm like raging. Like my testosterone, you couldn't even look at me. And I was kind of like, ugh, because you're just amped up.
Yeah.
And so then I went to another doctor. She's actually in my Christian mastermind. She's an amazing hormone doctor. And she was like, no, like we need to let that pellet go out. And it's, it's just experimental, right? Because you don't know how your body's going to absorb.
And everyone's different.
Correct.
Which is kind of the art of functional medicine.
Right.
Is you've got to treat each patient where they're at, how their body reacts.
Right.
And I might give the same dose of testosterone to one patient and it be totally different reaction in their body than the next.
Right. Like I'm a sensitive Sally, so I already know. I'm just sensitive, just so what, we start low on everything. But really it's, to answer your question, I test their hair, we do the protocol, and then I fill in the blanks, right? So like I have pediatricians that, part of their problems is they're not able to even eat. Right?
Yeah.
And so they don't really realize they're not getting the food. So then I put them on they're called Vitality Bits. They're spirulina. Because you obviously are not going to eat a hamburger or a sandwich in between patients. Because if a doctor walked in and to talk to me what they were eating, I would be like, what is that?
Yeah.
So,
you don't want to know what I ate.
It's fine. It's fine. But so I'm just saying like, it's hard. And so I just try and meet them where they're at, like, to put collagen in your coffee. Like, so all the lifestyle changes that are kind of easy tweaks, but we don't even think about them. And so, or if it's somebody that's, in fight or flight at all times, like I'm like, just say 5 things that, that before your feet hit the ground, say 5 things that you want to happen because you'll change the neural pathways because your brain doesn't know the difference. So you'll have the same feeling, but they don't even recognize that.
Just by changing your mindset.
Yes. Yeah. Or somebody needs to be told, have you ever told yourself that you're safe? Like the little girl. And I get a lot of tears with that one.
Sure. I mean, it's a big thing that I've been looking at too and talking with people is your mind controls so much of your body.
Oh, yes.
And it's amazing what we don't understand about it still.
Right.
But how we can use the mind to heal.
Yes.
And I love that for functional medicine.
Yes.
It doesn't always have to be this big fancy protocol.
No.
And so many people kind of need reminded of that.
That's the part. Like, that's what I've got grown, I had one woman, she's like, I prayed and you're the one that's going to heal me. I'm like, okay. And she was the one that delivered people from their stuff. Like, I'm like, that's a big, there's no pressure here. Okay. But I first thing I said to her was, do you ever tell yourself, the little girl, that she's safe? And she started crying.
Yeah.
And sometimes we just have to be reminded, like, it's not that we don't know. We almost, like, I used to have my therapist just have to say that to me all the time. And I'd be like, I knew this, but you have to be reminded by another human being, like, it's okay. Remember this?
Yeah.
And so it just depends. I'm a big believer, and I pray right before I see my clients because it's however he wants it to come out of my mouth and however the client is supposed to come. And I'm supposed to help them in whatever way because I'm trained in bioemotional healing too.
Okay.
Because the test will show emotions.
Really?
It'll show.
How does that
stress.
show up in the test?
So there's a wheel where it shows like your systems. And so it's adrenals, hormones, gut and intestinal, liver, your immune system, and it'll show emotions.
Interesting.
Yeah, it's pretty cool and it's pretty spot on. It's so then we go there, right?
And then you work with that and then retest 90 or
Yeah.
further out.
Yes. Yeah. And I don't
see how that changes.
Yes. And to make the record straight, I'm not one that's like I preach to my clients. I'm like, I meet them where they're at. So I don't ever, it's just for me, what works for me. Cause I raised myself as a kid. So that's how I operate. So that's my navigator. So I just do that to prepare for them. But I don't ever push my religion or anything on them.
Sure.
I just wanted to make that clear because.
But it's really important that spiritual aspect, it is part of our body.
Yes.
And connecting to that, the mind, the body, the spirit is important.
Yes.
It's not just a saying.
No, it's not. And it's really, if you just let him lead, it's kind of easier. It's, it's knowing that, he's bigger than us and that he leads.
How did your own personal story get you into this?
This is the part that's going to make me cry. Okay. So, really it was, I had 5 colonoscopies. But I came out of the womb stressed, right? My mom was an addict.
Out of the womb stressed.
I'm pretty sure that's what happened.
You're probably right on. There are a lot of people that do.
I was like, this is what it is. So, I mean, she was an addict. So like my dad left when I was 4 and my mom told me that my dad didn't want me. Was leaving for another family. And then she was, an alcoholic and an addict. And so she'd be gone for like a month at a time when I was in like 3rd grade. I grew up in Indiana. So
you really did raise yourself.
Oh, I did. So that's why my faith is so strong because that's all I've had when you're praying that you wake up the next morning. And then I had a brother that was a drug addict. So he would come home and beat the crap out of me. And then I would, I would just pray that he wouldn't be home. I learned how to drive when I was 11. So, and when I'm saying this stuff, I'm like, holy crap, I can't believe I've been through all that.
Yeah.
But I've done a lot of therapy and a lot of spiritual work to really work through it. And that's the other piece. I think that God put me through all of that as a child so that I could look at my clients and go, it's okay. We got this. I did this. You can do this.
When did you start your healing journey? Like realize like, hey, my path wasn't really normal. I need to heal and then help others.
You know what? Actually, it was when I got married.
Really?
Because of the abandonment. I felt like my husband, you automatically, it was so weird. Like you're supposed to be so happy. And I was, but the internal was like, he's going to leave me because everybody that loved me left me when I was a kid.
Yeah.
So that's what you start to, and so that was when I knew I had a problem. I'm like, this is not normal. So then I started therapy, but then I really started digging into who I was, what it was. And then what got me to the hair test was I had been with the doctor and he kept telling me I had gut issues and I, leaky gut. And he kept giving me all this stuff. And I'm like, it's not working. I don't know. And then my girlfriend was like, this was like 6 years ago. She said, you need to go and get a hair test. And at that time I was like, what is that? And I drove 2.5 hours to this lady's office and I had a parasite.
Really?
So I did the
So
parasite.
there was something gut going on.
Yeah, but I never got tested for that.
Okay.
Like he was giving me the preface, all the stuff. And I'm like, none of it's working. It's all junk. And then I did the parasite cleanse and I was good. Then that was when I brought it into my practice because I was like, this is nuts.
Yeah.
Like everybody should be able to feel that way.
So you already had a practice at this time. Yeah. But from your experience, you brought it into yours.
Yeah, because I feel, and it's really it's really my passion because I want, and we can mail them out. So I'm in all 50 states. And then we just do a Zoom call, but it's really because I want people to feel better and I want them to have the answers because I'm just, it makes me so sad. Like when people come in and and I'm sure you know about the orange pill, the orange progesterone pill. And when they come in and they're saying they're not sleeping and they're not doing well. And I'm like, what are you doing? And then they show me the orange pill. And I'm like, well, it's peanut oil and red dye. And there's like a teeny bit of progesterone in it. And your gut has to be on. Like you have to be able to digest it. And so then I always ask them, well, just ask for the troche or the cream. But and I don't think people know. Like I don't even think the doctors.
Yeah.
Because they're not going to tell you, like they're not going to tell you, hey, this is what's in it, so you just do what you have to do. So I'm not, I just think that there's a lot of things that we could just kind of move around. And if we knew better. And for me, I'm such a geek that I cut it open. I'm like, what is in this? How much is progesterone in that if they're not sleeping? Because I had so many clients that were just kind of saying
not getting the results from it.
And I was like, why? And then I just dug.
So you've just kind of learned this
I'm
as
such
you
a
practice.
geek. Yeah, I
love
can't,
it.
but I will dig in. Like, I've got clients that want this methylene blue, and I'm like, well, let me try it first.
Yeah.
And I've got a blue tongue, and I've got all this stuff, and it's blues all over. And but have you tried it?
We actually just brought in IV methylene blue.
Oh,
with our
wow.
clinic. I love it. Yeah.
Wow.
Yeah.
Yeah, it's pretty like amazing.
Yeah. I run ultra marathons.
Yeah.
And so I did it a bit before I did my last 50 mile. And I don't think I've ever recovered so fast.
Really?
Yeah. And it was the hardest race I've ever done so far. Just because it was like all sand through Antelope Canyon.
Wow.
And it was up and down ladders.
Yeah.
And literally halfway through, I thought this might be the first one that I can't finish. And so it all became a mental thing. And of course, right when I think that, I get to this aid station and this lady is there and she's like, gives me this pen, a little angel. And she goes, my husband ran marathons and he passed away.
Oh.
Will you carry this with you? And I'm like, well,
of course you're going to carry
it. Finish now.
Oh my gosh.
And then I had that mom guilt because, as a mom, like I left him with grandma and he had a flag football tournament that I didn't know was going to fall on that same race day. So I talked to him the day before and I was like, so buddy, I'm going to not be at your tournament. And he's like, it's okay, Mom. You win your race, I'll win mine.
Wow.
And of course, grandma texts right then that they won.
And you're like, okay, well, I will win.
Now I gotta go.
Yeah.
So
wow.
My long story short is having the methylene blue, I think gave me the mindset along with those two motivators to finish. Because I don't know if I would have. It was hard.
Yeah. Wow. Yeah, no, I'll have to come and check your stuff out because that's awesome with the IV because then it's not so messy.
And then my tongue wasn't blue.
Oh, you've got blue teeth for like 500 brushes.
Exactly.
Like even my dentist was like, what are you doing to your gums? Because you're like,
If you look at the pictures of like my first races, you'll see blue in my
Oh, because you've been doing it for a while then.
Yeah. About a year, yeah. So I ran a few.
It tastes disgusting though.
Yeah.
It's almost like tastes like poison. Yeah.
What about peptides? Are you using peptides? I know we
So I actually had I brought them into my practice because that one thing that I have is my clients trust me. So like if you can make your people feel seen, heard, and validated, they usually listen. And they trust me. So yes, they asked me to bring them in and it's a whole new ball game. Like I've been using peptides. I was using Simorlin like 10 years ago.
Yeah.
So I've used them forever, but to bring them in, it was, and I'm so particular and I'm very, I want to make sure that I'm serving my clients with excellence and but they know that. So yes, I did just bring them in. And, I was telling you about the Selenk that I just tried.
Yeah. How'd you feel with it?
Well, I actually tried it yesterday. You feel it pretty quickly.
Yeah.
And last night I did it right before I went to bed.
Mm-hmm.
I was like, this is amazing. Like almost like you're like walking on a cloud.
Yeah.
It was kind of weird, funny, awesome.
I mix this link with C-Max. And
you do?
I feel like when I use that, my brain is more even. Like, I'm kind of a very high energy and I'll go high, low, high, low. Yes. But I feel like I'm a little more stable.
Yeah. So so you have them as a mix?
Yes, I do.
Yeah.
I do.
Yeah. I was afraid that the C-Max would make me go higher because I ride high.
Yeah.
And so kind of like you do. So then I'm like, I don't drink caffeine past noon. Like, because I don't need any help.
Yeah. So I love this link for like that anxiety and that stabilizing.
Yes.
And I feel like the C-Max together with it just helps me so I'm not bouncing all over the place.
Yeah. And that's the other thing is like a lot of people show up, they've been prescribed the GLPs, which but they're not doing the nutrition. Like nobody's told them or they're buying it off the internet. And I'm like, you're sick because you're not eating. And like you have muscles because your body's eating itself. Like but so then I have to, get them on the spirulina and we do a whole new protocol.
Yeah.
Because I'm like, do you want to be on this forever? Because if that's your goal, you have to make it to where you're not on it forever.
Yeah. You've got to change the whole lifestyle so you have the foundation.
Yes.
And that's something someone had mentioned to me the other day. I was working with Dr. Deb and she said, you can give all these peptides to people, but if they don't have the foundation, it's never going to work.
Right.
It's like an artist taking a dirty canvas and trying to work with that. Let's clear the canvas, get a nice healthy canvas and then put those peptides
It's crazy. And I microdose, but it's when I tell them, they don't even believe me. I'm like, well, that's because I do it in a way that because I don't want to, you have to take aminos.
Yeah.
That's one of the things. So like my Olympian, that's one of the things that I see a lot too is like they don't, and I had a guy that was training for the Arnold Classic, huge guy, but he, protein synthesis. They don't really realize, they think that they're eating enough protein and they're really not.
Yeah.
They are, but they're eating like 50 grams in one setting and your body you can't even metabolize that much. So you have like the protein synthesis always comes up. So even like for my Olympian, Helen Morales, that she's the most decorated women's wrestler. Wow. And she's a powerhouse and she's an amazing woman. But she, I helped her because we had to do it naturally, but her protein synthesis was off. Yeah. And so then I was able to get her more protein, and we created a plan for her to get more protein like every 4 hours to turn it on to where she was able to have more energy.
I think that's the really neat thing is like everyone wants that quick answer, the fast fix.
I know.
But sometimes it's just the simple thing like getting your nutrition right, the timing of your nutrition.
Yes.
And it's okay if you don't know that. Like,
right.
I need reminders even.
I know, me too. I know.
And
if it's not out in front of me, I'm not doing it.
Yeah,
probably.
Yeah. And I get going so fast. Like you said, like quick food as you're going. Oh, yeah, I got to go do that. And
yeah.
So I think that's really neat that you have taken this journey and what you've learned and are helping people to really optimize their health, get to that root cause. And they have all these tools.
Yeah.
What's your favorite supplement you use?
I'd have to say my favorite supplement would be my Adrenal Assist and the magnesium threonate. Because I think most people I see, they are a lot of high execs, and like you ride high, right? So people don't understand when you have a lot of high output, you have to have input.
Yeah.
But the Adrenal Assist and the magnesium threonate at 2:00 is really such a big supporter because that's when your cortisol rises. So if you can get that to really like stabilize, you won't have that 3 to 4 o'clock afternoon slump. And it's the one that's the quickest. Like people are like, I'm not sleeping. I have this crash. And I'm like, I promise you, just do these 2 things at 2:00.
Yeah.
And within like a couple of days, they're like, I can't even believe it. So it's just, I think that's one. And it's just because we all ride high. Yeah. I mean, we live in a society that
is.
It's everything's like
we're
coming
always
at us.
in sympathetic. Go, go, go. A little pressure, cortisol up.
And ding, 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 ding. All the texts, like all the stuff.
Yeah. I actually brought in red light therapy.
Oh,
to our
that's
clinic.
awesome.
I did a podcast with Steven and Thriver Wellness.
Yeah, I know Steven.
And I just love the red light for me. Doing it just 10 minutes.
Oh, yeah.
Brings me out of this high into like a little more like calming.
Yes.
And I'm a better clinician. I'm a better person. I'm a better mom.
Mm-hmm. No, because you just need 10 minutes.
Yeah.
Like and that's all we really have anyways. But so like 10 minutes is great.
Yeah. So
that's awesome.
I love what you're doing. What do you think is the biggest stressor impacting people today that they should avoid?
That's a good question. I could say stress, but you're not going to sit in a bubble and avoid that. Yeah. I would say one of them is water and hydration, because I feel like people think that they're drinking out of these plastic bottles and they're getting water, and it's not even hydrating them because it can't get into the cells. It doesn't penetrate into the cells if you don't have like electrolytes or minerals to go with it. Mm-hmm. Plus, you've got the plastic that's going into the water. And we're in Arizona; it's like 110 out.
Sure.
And so all that plastic is going into the water. That I have to say like that, and the EMFs.
Yeah.
Plugging your phone in by your bed.
That's one I'm guilty of. And I'm trying.
So
I'm trying.
But if you knew, like if you plug in your phone, like if your phone's normal, it's like at 7. When you plug it in, it's like 700.
Wow.
And you probably have Bluetooth on.
We need to dive into this deeper for sure. There's so many things that, again, this is just an example of, even as we teach our listeners, our patients, we're learning too.
Oh, for sure.
I didn't get this in medical school.
No.
It's things you've had to learn from others, from other docs, from other people who've gone before us.
Correct.
And trial and error. Like you said, I think I've tried every peptide on myself before I tried it on anybody else. So
that's what I do. I'm like, okay, you want me to try that? Okay, all right.
I'll try it and I'll tell you about it.
Yes.
But there's so many. I could talk for hours with you about it.
I love it.
Thank you.
Yeah.
Give me your one piece of morning advice to help people to just be healthier.
Morning. I would say hydrate.
I love it.
On your nightstand, just have it on your nightstand. Because if it's on your nightstand,
not your cell phone, your
no,
water
not your
bottle.
cell phone. The water. Just have it by your nightstand, because then you have to drink it right away. And keep your phone outside of your room to not get on your phone.
Yeah. All right. So here's the deal. I'll agree to move my phone further away. and put water by my nightstand if you all will too.
Yes.
So, Christina, thank you for your time today. I can't wait to talk to you more and have a great day.
Yeah, thank you. Thanks.
Water, people. Water.